another episode in the Dementia Caregiver Series. And today I am joined by the beautiful Colette Afriyie. And Colette is a dementia care leader and brain health advocate. She's also the founder of Afro Cognitive Health Collective in Toronto. And Colette, I will give you an opportunity to introduce yourself, tell us about you before we go into this amazing interview.
Oh, thank you, Nya, and thank you for having me here on your podcast. It is a privilege to sit down with you. It is such a pleasure to see you do your work in community and touch so many people. So thank you for your service as well.
You're welcome.
So as Nya eloquently and beautifully said, my name is Colette Afriyie. I am a dementia care leader and I'm a brain health advocate. I have a nonprofit called the Afro Cognitive Health Collective, and what we seek to do is support the Black community around dementia care awareness, especially bringing about culturally responsive resources that help to support the community. And why I'm a brain health advocate is because I believe women specifically, we don't take the time to take care of ourselves, and we know that our brain is our wealth and our health, and we should take very good care of it. So what I try to do is try to encourage women to take care of themselves, take care of their brains by implementing really simple techniques in order for them to strengthen their cognitive health and improve overall health outcomes. So that's what I do. I am a mom of 5, I am a wife, and I am the Mrs. Universe Jamaica finalist, or one of them, for 2026. And so I'm really excited to represent my beautiful country of Jamaica, my beautiful parish of Clarendon, and just be a part of such a huge movement and being a part of such a great stage and platform. So that's a little bit about me.
Amazing, vast, multidimensional. I love it. So Colette, can you tell us how you got into this space? What really propelled you into becoming a dementia care leader? Give us some background into that.
Sure. So how I got started in dementia care is really like serendipity. It's not something that I actually wanted to do. I actually went to school for broadcasting. So that was my heart and my desire was media. But back in 2016, my mother started to show early signs of dementia. And I wasn't sure that, I didn't know it was dementia because she seemed to be a bit sad and depressed. She was going through something that was very challenging for her at the time. So I didn't know that it was early signs. And then in 2017, it became very apparent that my mom was beginning to show signs. And those signs were, well, one of them were she was laid off from her job. So she was looking for a new job and had a challenging time filling out the application forms. And the other was that she got lost on her way home. And one of them was also always frequently forgetting what she was going to do. And she would always say, hey, what did I go for again? And she would do this constantly. But the biggest thing for me was when she wasn't able to fill out the application form. My mom is a very proud Jamaican person who loves her heritage, loves where she comes from. She takes very high pride in her last name. And for her to not be able to fill out her last name and application form was very heartbreaking for her. And I remember her saying, you know, what's happening to me? I'll never forget, you know? So, and that my heart just dropped. And I just said, oh no, mommy, you're okay. Like, you know, like you can do this, right? And I even was a little, I guess when the feeling comes on of like, this can't be it, you kind of push back. And I was like, oh, mommy, no, like you're okay. You're going to do this. You can fill out this application for it. But deep down inside, it kind of confirmed what I was already thinking, you know? Yeah. So that's when I thought to myself, it's time to bring my mom to a doctor. We brought her to her first doctor. Doctor said it was depression, gave her antidepressants. My mother slept a lot, but you know, nothing really changed with her memory. And so then I brought her to my family doctor where she was diagnosed with young onset Alzheimer's dementia, which means that she was starting to show signs of Alzheimer's disease at a younger age. And when she was diagnosed with a doctor, like I remember being in the room with her and I when the doctor said the diagnosis, she had to tell me the diagnosis 3 times because,
Yeah.
the initial shock, like, again, it was like, whoa, this is really, it's like the dots are connecting and you're not ready for it to happen.
Yes.
And so when she said it, I said, what'd you say? And she said it again. I said, what'd you say? And she had to write it down on a yellow sticky note. And she said, young early Alzheimer's disease, or onset Alzheimer's disease.
Yeah.
And that's when my mom was officially diagnosed. And that's where it started. And so I remember being a part of other women's group, trying to find solidarity, trying to see if there's anyone else that was going through what I was going through. And there was no one. And at the time I was 31. And I couldn't find much support. This is, and I should give some prefaces to this, like some background, that my grandmother was diagnosed with Alzheimer's disease. So I already had some interaction with the disease, but
Yeah.
now it's even closer because it's my mom and she's young, right?
Yeah.
So there wasn't much support at the time. When the pandemic came around, everybody was reconsidering their whole life. Like, what
Yeah.
can I do now, right? Because we're home, and all the major platforms, everybody's on it, and
Mm-hmm.
so we're re-examining ourselves, see like what
Mm-hmm.
else can we contribute. And I thought to myself, hey, I should just go back to school, because I was a mom full time, like stay at home mom full time. And
Yeah.
so I was like, okay, I'm gonna go back to school to be a personal support worker. And it was through going back to school to be a personal support worker, I landed on a dementia care floor.
Mm-hmm. Mm-hmm.
And I was like, no, like, you're
Yeah.
not putting me on this floor. And I remember I told the nurse that was there, I told her, I don't think I can do this because my mom has dementia. This is very
Yeah.
overwhelming. It's like a constant reminder. I just can't handle it. And
Yeah.
she said, you are training to be a personal support worker, and no matter what floor you're placed on, you should be able to do it. And I think you're going to do a great job. So I'm not going to move you. And I was like, oh, excuse me.
Yeah. Yeah.
So
Yeah.
I had to get it together, girl.
Get it
And then
together.
I got it together, and you know what happened? It was the best thing she could have ever done,
Yeah.
was not allow me to um, get into my feelings too much, push past my feelings, and give this opportunity a try. Because through
Yeah.
that, I realized I love working with people living with dementia. I love to support them. I love to get to know them. I love to find ways to connect with them. I understand responsive behavior better. I wanted to
Yeah.
understand why the brain was. So it just kind of opened up a new passion for me. And then I decided to start the Afro Cognitive Health Collective, just supporting the Black community because people wanted to learn more. People were calling me, or I heard your mom has Alzheimer's. I wanted to know, what do you think? Did my mom have it? Like, what did you do? And that's how I started Afro Cognitive Health Collective. That's a very long introduction, but at least you have a background story of like my why.
Yeah. And the why is important because it really solidifies the work that you do.
Yes.
Colette, so your mom got the diagnosis.
Mhm.
Do you think that you were prepared to become a caregiver? And I'm asking that because some time ago I was speaking to a friend and she said, I enjoy watching your interviews, but at a certain point I have to stop because the reality is too much. My parents are also aging. And she said to me, she doesn't think everyone is cut out to be a caregiver. Can we
Mhm.
speak about that?
She's absolutely correct.
Mm-hmm.
And I want to also say that it's okay. It's
Yeah.
fine. It's okay that we're not all cut out to be care partners.
Yeah.
So was I prepared to be a care partner at that time of my life? No, I was not.
Okay.
I grew up with having to be a care partner for my sister, my older sister, who was born with special needs, and I
Okay.
had to take on that role very early. And then when my younger sister was born, I took on the role as well, being a care partner, and my mom did her very best. And
Mm-hmm.
I think, especially in Caribbean households and a lot of traditional homes, daughters become care partners very early in life. This is something that we see in most traditional homes.
Yeah.
So I as I got older, especially when I moved into college, I didn't want to be a care partner. I wanted to discover myself. I wanted to see what else I can learn about me. I wanted to experience the world. So I wasn't really ready. And although I was a mother by 26 and by 31, I would be a mother of two, I
Mhm.
certainly wasn't ready to be a care partner. I wanted to um, to grow my relationship with my mother because I understood what it was to be a mom because now I'm a mom and I
Yeah.
appreciate my mom so much more than I did before. I think I've always had a love for my mother and a genuine care for my mother, and she's like one of my heroes and someone that I look up to in terms of like being a very, very compassionate, loving, loyal, like just such a good person.
Okay.
But I think as I got older, I understood the magnitude of her sacrifice for me and what she's done for her family. So I was ready to like just be my mom's best friend. And I wanted my mom to be my best friend. But then by 31, when the disease stepped in, it made it very difficult for that to happen. And I had to wrestle with the fact that I would be losing my mom at a young age, and my younger sister would be losing my mom at a younger age. And so I stepped into like I stepped into being a mom, if you will. And I say it loosely because my sister has a mom and she's still with us.
Yeah.
But, you know, I felt guilt for the fact that my sister had to experience the loss of her mom at a very young age.
Mhm.
And I stepped into that role, trying to protect her as much as possible, and then also trying to like support my mom as best as I can. And of course, I have two young children that I'm trying to raise as well with my then partner, now husband. So it was no. The answer is no, I was not ready to be a care partner. But I think because especially again, in traditional homes, women, young girls are conditioned to be prepared to take care of the home. I
Yeah.
kind of went back to that, natural, I guess, instinct of supporting, but it's not the same. It's
Yeah.
different. It was different this time.
Yeah. And I like that you spoke about your relationship with your mom and the like culture. And we're supposed to take care of our parents and not put them in homes, take care of them at home. And this week you had an online workshop that I attended, and we were speaking about the reality of long-term care,
Mhm.
right? And in the Black community, we see it as sort of a failure or neglect or abandonment when you place your loved one in a long-term care facility, right?
Mhm.
Right now your mom is in long-term care.
Yeah.
What was the thought process in making that decision, and what would you say to people who carry that guilt that if I decide to put mom or dad or my sister or my cousin, whoever, in a long-term care facility, that means I'm neglecting them, I'm abandoning them? What do you have to say about that?
So at the beginning, when I started to try to access resource for my mother,
Mhm.
for her to have like a personal support worker come in, and for those in the States, that would be equivalent to like a CNA, or the Caribbean as equivalent to like an associate nurse. So when I was looking at getting resource for my mom, I had a very good friend of mine who reminded me of the importance of taking the time to plan out my mom's care plan appropriately and also consider my own care. And through that advice, I decided that maybe it was good for me to place mommy on a long-term care home wait list, in the event that she needs more support, or in the event that I need more support, that she could get it and I could also get the respite care that I also needed. So, but for a few years, she was not in long-term care. I think the pandemic really expedited the need for long-term care,
Mhm.
um, because at that point, to paint a picture, we were owning a business. My husband worked overnight, and we had our then last child, our fourth child. She was young, and I was also caring for my mom at the time. That made it very challenging for me. And of course, thankfully to the Alzheimer's Society of Canada, I got access to the Adult Day program, which I'm very grateful for. And because they saw my need and they saw that I was pretty much in crisis mode, they advocated for me to get my mother into adult day programming every day, which really, really helped me. And then I also got PSWs coming into the home every day, and I'm grateful for that. But I still felt like I got all the support, so I would not take away from that. I think that it still became very difficult. Going out with my kids made it challenging because I would have to take my mom.
Yeah.
And at that stage of the dementia, that's when it became very challenging to take her out with me with the kids. It was challenging. My sister was in school full time, having to work two jobs because her parents, right? Like my mom wasn't very well. My dad is also aging. So like she was taking care of herself. And so it was very challenging to have all the support necessary. And of course, I do not blame anybody for that. But I recognize that it was becoming too heavy for me to carry.
Yeah.
And I think also the guilt um, that comes with not being able to be the best care partner you can, especially when you're just exhausted. So there was a time where I was sitting on my mom's bedroom floor and she was sitting in the rocking chair. And I thought to myself, man, if I don't do something, I'm gonna end up in the hospital or she'll end up in the hospital because I won't be able to support her the best way that I can.
Yeah.
And I had to be honest with myself that I am limited. I can only do so much. At the time, I did not have my personal support worker certificate, so I didn't understand what was needed to support her better.
Yeah.
So I made the call and they placed my mother on a crisis wait list. And within a week, a bed became open and my mom was placed in long-term care. And I remember thinking, like, what is my family going to say? I think my family is very understanding, and I know that they knew that this time would come, but um, it's the shock of it. It's the shock of the disease. It is a disease where you will grieve many times throughout the journey. And I think that my family just wasn't ready to like admit or come around to the fact that something's really wrong with my mom. Like they knew, but it's hard. It's very difficult. But I made a decision and my mom was placed. And to be honest, Nya, it was the best decision. First, I didn't know the weight I was carrying. I knew it in terms of like weight I was carrying. I didn't understand. I didn't like. I knew it in terms of the to-do list, but I didn't understand how my body was internalizing the stress.
Yeah.
And it wasn't until I was driving home, a little bit of the weight was starting to fall off, and your soul feels it, your body feels it, right? And so you're like, oh, it was a good decision because I'm tired. And
Yeah.
then it took me, and I know some people like, how could you do this? Like after a few weeks of seeing my mom, like making sure she's okay, coming to show up, and I started to get really tired and I said, okay, I need to rest. So other family members would go and see my mom, but I had to take a moment because I was extremely tired. And my mom actually is looking fantastic because you have a clinical group of professionals who
Yeah.
know how to monitor someone and they specialize in geriatric care.
Yeah.
And so you see the improvement in my mother's skin. You see the improvement in like, you know, her daily activities because they have programming. Like there's so many things that kind of enhance her overall well-being. I
Yeah.
could not provide that, right?
Mm.
Like if they say, well, your mom, for example, because she was putting on some weight and looking very nice, might I add, right? But they're like, she's living on the heavy side. So what do you think of us changing her diet so she
Yeah.
doesn't get too heavy? Stuff like that, right?
Yeah.
Or they're able to measure how much water or fluid she's taken, how many cups does she drink today, is she meeting like the requirements of fluid intake. Is she passing enough fluid? So all these things really improved her health,
Mm-hmm.
her health outcomes. And
Yeah.
so when I look back, I now know that it was a good decision. Now I know for some people,
Mm-hmm.
this may not be the case because of there's cultural context or other context missing. And my mom is in a long-term care long-term care home where it is multicultural. So
Yeah.
there is diversity there, and there are nurses and PSWs and doctors and people who look like her that support her and understand the nuances. So she is getting really good care. And so I don't want to negate from others who are not having the best experience in long-term care, or maybe having some questions or like hesitancy in placing their loved one in long-term
No.
care.
Thanks for sharing that. I remember when I was at HK Walden in Calgary,
Mhm.
and there was a multidisciplinary team when
Yes,
we would go and discuss each client's care plan. And
right.
you had the nutritionist, the
Yes,
social worker, the
yes,
physiotherapist.
yes.
So we had like an entire, like the whole picture of the individual and
Mhm.
how we could make different like tweaks to different things to
Right,
ensure that this person is aging well,
right,
they're aging in a very dignifying way. So that's
right.
important.
Mhm.
And I recall we had a conversation and we were saying that long-term care, like the history of long-term care, they've had a bad rap, and there are some long-term care homes that do not do as we would like them to, right? The care plans, the coordination, the foods, the activities, they don't really enhance
Mhm.
the well-being of our loved ones. What do you have to say about long-term care facilities, and if somebody were to look for a long-term care facility for their loved one, what are some of the things they should be looking for?
So if this is for a person of color or a person or a minority group, the first thing you need to look for is diversity.
Okay.
That actually matters so very much. And I
Mm-hmm.
would say, especially if your loved one is experiencing dementia.
Mm-hmm.
So diversity is the first thing. Second thing is how many workers are on the floor? What's happening on the floor? What's on the walls? What are the activities like? What does the environment feel like? So I really encourage going out and doing the orientation that
Yeah.
long-term care homes provide. It gives you a sense of what's happening. What did you notice that you didn't like? What did you notice that you do like a lot? You can ask about the menu. What are they eating today? What does that even look like? Activities. You can ask for the activity log. What have they done in the past and what are they planning to do in the future?
Yeah.
Um, and of course, cleanliness. Take a look, make sure the place is clean,
Yeah.
and just take note. Also, open up your ears and listen. Now, usually we would say like you never judge an environment upon like walking in because there's so many things that make the
Mm-hmm.
environment what it is. But
Yeah.
pay attention to how professionals are speaking around other residents and
Yeah.
see and wonder to yourself if this is what you would want for your loved one as well.
Mm-hmm.
So diversity, um, environment, including what are on the walls, what are the happenings, how do they involve residents in everyday activities, look
Yeah.
for cleanliness, listen to how people are speaking to their residents,
Yeah.
and also how easy is it to access the the director of care,
Yeah.
right? Like, are if you were to send an email, how soon do they respond, or whomever is the first point of contact that you should be speaking to? Could be director of care, could be admissions at the time, maybe admissions.
Yeah.
But look at communication and how soon they respond to some of your concerns.
Yeah.
So These are the things that you should be looking into.
Yeah, going beyond the aesthetics, because right now
Yeah,
aesthetics is a big thing.
yeah,
And that is really important because we hear a lot of people complaining that their mom or their dad, their loved one is not receiving the appropriate care in some long-term care
yeah.
homes.
Mhm.
And it brings us back to what I'm really passionate about, person-centered
I
care.
was gonna get there. Like I missed that. Go ahead. Go
Yeah,
ahead.
because it is so important. It
Mm,
allows us to go beyond the medical model that just sees deficiencies and see that, oh, they can no longer remember names or they can no longer do this for themselves. But person centered care is saying to us, okay, let's see what still remains and how we can capitalize on that. How can we understand this person's history, who they are? And
mm,
how we can use this information to create a care plan that still allows them to age with dignity and
mm,
autonomy and
mm.
includes them in the daily care, right?
Yeah.
And I feel like there are some long-term care homes that are going in that direction and implementing it. I see a lot of that happening in places like Japan, China, Hong Kong, where they have all the games. And
Mm,
the people are still engaged. The food that they're eating, the
mm,
clothes that they're wearing. Like, you can't have people in nightgowns the
mm,
entire day. Nightgowns are for
mm,
going to bed. So,
mm.
all of that. What do you think, Colette? And did you implement that? Probably you did not know it was person-centered care at that time, but
Mm.
did you include elements of that when you were caring for your mom, or do you see it happening now with your mom?
So with my mom, because she cared, she had a daughter with special needs. My
Mhm.
mother was very high on person-centered care. You
Yes.
knew what my sister liked. You knew what color she liked. You
Yeah.
knew how she liked her bedroom. You knew how she liked her hair comb, even though she was nonverbal. My
Yeah.
mother made sure that she prioritized what made my sister really happy, and
Yeah.
and made sure she prioritized my sister's expression, even though she was nonverbal, right?
Yeah.
So that is something I saw growing up. So my mother was not in her 90 all day. Like she was, changed and taken care of, and we implement things that she really likes, right? When she moved into her long-term care home, that long-term care home is really great because I worked at a different long-term care home and they're behind when it comes to person-centered care, right? So in this long-term care home, they called me and they say, "Hey, my name is da 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 da. I'm the social worker, or and I'd like to know a little bit more about your mom. Even the package that you get,
Yeah.
they ask you, what does your loved one like? Do they have a faith? Do they have a practice? Do they have a ritual? Like what do they do in their past? Like so they ask you questions about your loved one, but then the social worker or maybe the person that handles activities also will call to say, hey, we'd like to know a little bit more about your loved one. Tell us, like, what do they enjoy, the foods that they like because we're creating a biography that they put outside the door. So it doesn't matter what PSW is working, they get a general sense of the person. So the long-term care home that my mom is in is a really good one. And
Yeah.
they also implemented the butterfly model, which means
Yes.
that which means that my mom is in a secured unit, but the other side of the unit, people are walking around. They don't necessarily have dementia, but now they keep those doors open. So someone living with dementia can walk around the whole unit, and the
Unit.
entire walls are filled with so many different activities and maps and textures on the wall and
Yeah.
pictures and just so many things. And then there's also a little bit of music playing. They always have like the cafeteria open for drinks. There's
Yeah.
always a PSW there just for that,
Yeah.
because that long-term care home is multicultural. There's a lot of Italians, there are a lot of Jamaicans or
Mhm.
Caribbean individuals there. There are a lot of South Asians, East Asian. So there's a sense of like we like to sit talk, and drink. So they make
Yeah.
sure that they have water, coffee, tea, juice, anything there. It's always open. And they have a little like cafe spot where individuals can sit down and have a coffee and tea with their friends at another location that's not in the cafeteria. So
Yeah.
they really, really, really implement this beautiful sense of community.
Yes, community.
It is so nice. I
Mm.
really enjoy being on her floor, and there's so many more people there. So there's a lot more eyes on the floor, a lot more nurses. It's busy. I don't know. I just really like being on her floor, and I think they did a great job. So for me, I'm really happy with the fact that they're implementing that model. They've implemented that model, and that my mom is a part of it. It's so great.
Yeah,
Yeah.
I love that you mentioned the importance of community because I had a client, right? And like if you saw her, you would never think, Colette, that she has dementia. And I
Mhm.
can really say that with her example, you can see that going back to her roots, there was some healing that took place. Like,
Mhm.
yes, it's a degenerative disease, but there was an element of healing because she's happier, she's
Mhm.
thriving, she's glowing more.
Mhm.
It's just different. And two, she can no longer communicate in English. She's now communicating in the native language,
Mhm.
right? So being back home and now she can communicate with people who speak the language is just something beautiful. And you did an amazing job some time ago in translating that information in different cultural languages.
Okay, it's okay.
Yeah.
Yeah, it was a great social media campaign, and what we were trying to do, and I think we did a good job in doing it,
Mhm.
was to bring about dementia awareness and education to other groups of people,
Yeah.
because we know for a fact that Black people do not all speak the same language.
Mhm.
So we want to dismantle and take away any type of hurdles that would permit someone from understanding early signs of dementia and how to access care. So the three languages that we focused on was French, Tree, and Patois, which is a Jamaican dialect,
Mhm.
and to kind of give the information about what dementia is, and that really helped with kind of breaking up some barriers. And as to your point, because direct translation does not mean understanding,
Yeah.
right? Like there is still cultural context to everything that we do and we say, and
Yeah.
so it's important that the person who is giving the information, especially if it's in a language that you don't speak, that it comes from them, because they're able to like form the sentences, approach and greet the groups appropriately, so they're able to receive that necessary information. So with the nonprofit, we do seek to support everybody in the Black community, irrespective of any languages that they may speak.
Yeah. That is really good. And Colette is doing some amazing work in Toronto. You're going to be having the dance coming
Yes, the line
soon. You want
dancing.
to tell us about that?
Yes, so this Saturday, we are partnered with the Alzheimer Society of Peel, and we will be having a line dancing event and an education workshop for care partners. So we are trying to engage a Black community to come out, learn a new skill, take a load off, meet new care partners, and then learn a little bit more about dementia, how it works in the brain, and how to access care from community resources like Afro Cognitive Health Collective, and also like the Alzheimer's Society of Peel, who partnered with us on this event.
Yeah, I wish I could
Yeah.
have attended. It's
I'll
too
fly
far.
you over next time, girl.
Yeah, next time, next time. Colette, any last words that you want to, anything that you want to say to caregivers out there?
Dementia is it can be a very aggressive disease, and sometimes it moves so quickly that you cannot catch up with the changes. And I want to let every care partner know that, first of all, take a deep breath and feel what you're feeling, and know that everything that you're feeling is okay, including frustration, anger, including the fact that you may not want to be a care partner. You may not want to engage in this way. You're not ready. I want to affirm how you're feeling so that we can heal or start to understand what we're feeling so we can better support that person living with dementia. And everyone's dementia looks different from person to person. You know, for my mom, she wasn't as, I don't like to use the word aggressive, but as responsive as other people who may be very responsive.
Yeah.
Know that that's usually tied to an unmet need, and it's not you, right?
Yeah.
If you're looking for more support, you want to understand what dementia is all about. You want to understand what kind of resources are available for you. The Afro Cognitive Health Collective is here to support you in any way possible. We also have the Aging Tapestry led by Nya. We also have the Alzheimer's Society if you're in Canada. And there are other resources out there that are just ready to support you and help you. So if you're looking for extra support, someone to talk to, resources, or you just need direction, DM myself or DM Nya, and we'd be more than happy. I'm more than happy to help you and to support you, because dementia should not be traveled by yourself. It is a community effort. It is a journey that you must lock hands with somebody else.
Yeah.
And it is a journey that is vulnerable, makes you very vulnerable, and makes a loved one that you're supporting very vulnerable. But in order for you to be truly vulnerable, you must have community and have people around you who see you and what you're going through.
Yeah. Thank you so much, beautiful Colette.
Thank you, Nya.
Thank you so much for engaging me, and that conversation was so necessary because we did explore things more from a macro perspective, and long-term care, the policies, and how that affects people in moving forward. So thank you so much. If you're new here, you can catch up on the previous interviews. And if you need to connect, you can connect with me at the Aging Tapestry on Instagram or on YouTube, or send me an email at the Aging Tapestry. Thank you so much, Colette, and have a good day.
Thank you, Nya.
Yeah.